has been a difficult one to explain. So at Caregiver Saathi, we work with a framework of well-being, which has 7 elements. And of these 7 elements or 7 aspects, one is creative expression. And many people ask, why is it that creative expression is a part of your well-being framework? And it is something that we would like to integrate with an individual's well-being. And today we will explore how music can be an expression. Although often say that performing arts is how usually creative expression is seen. But performing arts is not the only creative expression that one could have. Frankly, in living our lives and expressing ourselves uniquely, one could go from performing arts to actually just our everyday expression of ourselves. So even in how we dress up, how we cook, how we look after our home, how we express ourselves, say with our hobbies, are all creative expressions. Um, the topic for today's conversation is, can music be a part of palliative care, especially for cancer patients? And as we jump into the conversation, I would like to first start by giving you a brief introduction to Caregiver Saathi. This webinar is brought to you by Caregiver Saathi, and Caregiver Saathi is a young organization attempting to build an ecosystem of well-being and healing for the primary caregiver. Primary caregiver is that family member, that one family member who carries the responsibility for looking after the loved one who is navigating an illness, which might be terminal illness or a chronic condition or something that is life limiting. In our current world, where we have increasingly nuclear families and fragmenting communities, the responsibility of caregiving often falls on one person. That is why that person is the primary caregiver. If you look around, you will most certainly be able to see caregivers, not just in your family, but among friends and colleagues. Family caregivers of those navigating terminal illness, chronic, or any other life-limiting condition, which basically means incurable conditions, have unique challenges. And we would like to support them in their caregiving journeys and beyond. What do we wish to do? We wish to create an environment of well-being where the caregiver feels empowered. We believe very, very vehemently, strongly, that each one of us deserves to live a full life, and each one of us deserves to enjoy whatever the length of life one might have. Whether or not you have the illness or you're looking after the person with a life-limiting condition. So both the caregiver and the care receiver can lead full lives. So what can we do to make that happen is the mission for Caregiver Saathi. How do we do this? There's nothing that we can't do with technology, but we can't leave the magic of human connection and human touch. So we do this by having awareness programs, both online and offline. Many of you might feel that, and might encounter this, that I'm not a caregiver. I'm a responsible parent, I'm a caring partner, or I'm a loving child. But very few of us see ourselves as caregivers. At Caregiver Saathi, we believe that being able to see oneself as caregiver can be the first step to your taking support and being able to get that sense of empowerment and healing that you need. We have a helpline, we have healing circles, we communicate using social media. You can follow us through all of the social media handles. We provide access to relevant information, and through our platform and app, we hope to provide a lot of support to our community of caregivers. What have we done so far? We have built a few resources. Gentle Warriors is our series of videos and a podcast series that we have where we tell stories of caregivers and their caregiving journeys. We call them Gentle Warriors because that's how we see them. We have a technology enabled platform, which includes an app and a website. We provide education both online and offline. The app is designed for caregivers so that they can organize themselves. Two things that caregivers find most difficult are finding time and creating the space for themselves. We believe that our app can help caregivers organize themselves and get access to information so that they can create the time for themselves. We have a community both on Facebook and on WhatsApp. We also have expert series, both in video and webinar. Today, you are in the Compassionate Caring series. These are series in which we bring experts across various fields, specifically linked to our framework of well-being, so that we can provide a perspective on caring to caregivers. We believe compassionate caring is when not just the patient, but the caregiver as well has a sense of well-being. Unfortunately, in many cases, while the patient is taken care of, it can sometimes be at a significant cost to the caregiver. By compassionate caring, we are trying to strive for a balance. We have one-on-one caregiver coaching, family counseling, a volunteer-based respite care program, and a bereavement and support group and grief counseling as well. How can you participate? You can participate by joining the healing circles and support groups. You might wonder that you're not a caregiver, so do you need this? Very often, participating in the healing circle can enable you to encourage the caregivers. You can tell us caregiving stories that you know, or encourage caregivers to tell us their stories so that we can amplify their voice. You can help us spread the word in person and on social media by joining our social media handles. You can volunteer with us for your skills and time. You can help us raise funds and donate. We are an entirely donation-based organization. And we also have an intense internship program, which you could encourage people to participate in. And finally, we would need referrals both with partners, all with partners, hospitals, and organizations. That said, what is this framework of well-being? And it has 7 elements. At the very core is the triangle of physiological, spiritual, and psychological well-being. So this is the individual's well-being at the very core. And in terms of an interface with the world is the social well-being, the financial and legal well-being, and having a life and work purpose. All of this in terms of being a human and having a creative expression is the 7th and the critical well-being element of well-being. Stress is caused when there is an imbalance in one's well-being, and unaddressed chronic stress can lead to mental health issues. Individuals can build resilience through practices of mind, body, and soul. And with that, I would like to welcome and introduce our today's speaker. Welcome, Dr. Tara Rajendran.
Thank you.
All right, so Dr. Tara Rajendran is a doctor and master's in fine arts, physician, musician. I have been so impressed with her ever since I have first met her. And I am sure that you will be adequately swept off your feet. She graduated out of the nation's one of the 6 institutes of eminence, Manipal Academy of Higher Education. in the top 1.2 percentile of undergraduate students in the country, which means top 15 national finalists for the world's most prestigious and expensive scholarships, the Rhodes Scholarship in 2018, for her academic brilliance, outstanding extracurricular achievements, and leadership qualities. She was also the Oxford University DPhil Oncology Program finalist in 2018. In 2020, Link the Dots named Tara as one of the 20 brilliant Indians in their 20s. I'll take a pause to let that sink in. Tara
Thank
founded,
you.
you just have to let that sink in. So Tara
Okay.
founded a self-initiative first lecture concert series called Oncology and Strings to advocate the importance of inculcating instrumental music therapy into India's palliative cancer care. Launched at the Stanford University campus, Tara, at the young age of 25, was invited to deliver lecture concerts at TEDx, Kasturba Medical College, Manipal, and at India's premier cancer center since its establishment, TMH, as a chief guest and panel member. And alongside, Tara lends free MP3 Veena recitals to palliative centers across India and the United States. It will take some time to let the whole of this sink in, Tara. And while we let that sink in, let me make some admin announcements. We will spend the next 60 minutes to have a discussion or a presentation regarding the topic for today and its implications for compassionate caring. We have three parts. We will have a brief discussion. You're encouraged to share your thoughts, questions, and whatever expressions you may have in the chat box. We will have a question answer session followed by some feedback and suggestions. You're requested to keep your microphone muted at all times so that we can minimize background sounds. And when you're invited to share, you may unmute yourself. If you are seated and your camera is stable, then please keep it on, else you may turn it off. We are going live on Facebook right now, and we will be using some parts of this discussion for designing further similar programs in the future. With that, it is time to welcome Dr. Tara.
Thank you, Bhavana.
Your opening remarks. As
I'm really excited and thrilled to be part of Caregiver Saathi's this platform. Thank you so much for this opportunity. Thank you so much, Bhavana.
So let's start with your understanding and your story and your association with music.
So I started my Indian classical music vocal and the Saraswati Veena training at the age of 4 and 7 respectively. And I started giving invited National Music Festival performances by 11 and 12. And after that, I have been performing to an audience which is predominantly consisted of musicians or who are trained in music, that elite, classical music audience. And after that, I joined medical school, and it was a break, and I gave, break in the sense, break to performing music, but I turned into academic music. I started my bachelor's and master's in Saraswati Veena. And I kind of somehow kept the instrument to the corner room. And in the final year of medical school, I vividly remember it was a labor theater duty, obstetrics and gynecology rotations. And one after a night shift, I was returning to my room and I was exhausted, uh, to a point that I was crying. That I don't know. I just felt that there was a heavy mass on my head. Um, I started crying, and then I saw the instrument, and then I played it for 15 minutes, and I don't know what happened. I just felt there was no mass over my head anymore. That was the first ever realization or a revelation that, okay, like it worked with me. Music helped me reduce my anxiety. It is anxiolytic, right? And then I started reading about music therapy and how it is, and what is the present scenario in India and anywhere else. And during that time, I happened to pursue a short elective as a final year medical student at Harvard and Stanford. And on one of those times, my mentor and the advisory dean of Harvard Medical School picked my interest both for oncology and Indian classical music. And he said, why don't you explore the intersection of classical music and oncology, and thereby, heal people, explore that field. And he guided me to one of the leading music therapists, and she told me that, in order to practice as a music therapist, you need to have a music therapy certification, board certification. But then uh, you don't have that, but then even then you are a performing artist and also a physician, so do not underestimate your capability of playing music patients in the wards, in your wards and floors and chemotherapy rooms. I think that will be wonderful. And that was the beginning, I would say. And I started doing a randomized clinical trial in back in my medical school. And on one of those days, I started Oncology and Strings, advocating about the need of instrumental music therapy in the Indian healthcare infrastructure. So that is my journey in a nutshell.
It's quite incredible. We have just launched a poll among our participants to get a sense of how many people are caregivers and how many are people who relate to being to different roles with a caregiver. And while people respond to that, I think there are so many layers to your role, Tara. And I see, I'm curious about your association with caregivers. And what do you think, your association with Caregiver Saathi?
Uh, I'll start with caregivers and my interaction with caregivers, and I mean that is with the healthcare providers and their exhaustion related to that. So initially, from the beginning of medical school, I was passionate about oncology, and I was I was having this opportunity to rotate in the oncology departments, and then I happened to I think understand and understand the stress and anxiety and mood disturbance, depression, all those kind of issues uh, on experienced not only by the patient but also by the family, right?
Mm.
That is one thing. And then when I started Oncology and Strings, I think I was exposed more towards palliative care and the physicians and as well the caregivers. And it has only been like an year since I started. So I'm just beginning to understand and explore. And Caregiver Saathi, definitely I happen to come across it in the last 6 months, and I was fascinated because I would say this thing that I do not know many organizations and many people who advocate about the psychological well-being and physiological and psychological well-being of caregivers, because we are, there are two extremes, one with the patients and one with the physician exhaustion and physician burnout, but nothing with the caregivers and the family, right? So that, I think it's an incredible job, and I'm really appreciative of Caregiver Saathi and the wonderful work they're doing in terms of advocating and social media networking and connections, etc. So I'm really thankful for that.
Thank you for saying that. It's been such an incredible learning to have discovered you along the way, and the passion with which you approach music therapy and everything else that you do. So I am keen to understand what would you, so given today's session, yeah, how would
Yes.
you, knowing that, in our audience, predominantly we will have family caregivers and caregivers of a
Hmm.
variety of medical conditions. So it is not just cancer, it could be
Cancer.
a variety of incurable conditions, including aging. And
Hmm.
there is definitely an impact, or there is definitely a recommendation for patients. But how do you see music and its role for family caregivers? What do you
Okay.
think that family caregivers should know about music as they tend to
Okay.
themselves as well as their loved ones?
Okay. So I will start with this, that in a place where there is music therapy has a definition. Okay. So in the US, so there is a particular organization called AMTA, American Music Therapy Association. So where that's an association of music therapists who, a group of people who, set the guidelines, etc. So now, what is the advantage of that? So they have this board certification, and those who are interested in music will come and get trained, and they will be after their board certification and licensing in music therapy, they will be allocated to private centers or houses or even hospitals to perform and practice music therapy. Uh, but in India, we do not have that system. We do not, although there are diplomas and private institutions that give board certification for music therapy, but there are no institution, there are no diplomas, there are no board certification that is validated by a centralized governmental agency like Medical Council of India, right? So if there is a palliative care fellowship program, you cannot just start it from nowhere. So you have to get accreditation from, this is the right kind of fellowship. These are the the 3 years and the curriculum of that. There should be someone to set that up. So Medical Council of India is that for the medical and all the healthcare related things in India, and they haven't given any accreditation for music therapy. So getting a music therapist and getting the making use of music therapy will be a little bit tricky in this scenario. But what we can do is, I think, listening to music for a stipulated amount of time. I wouldn't say like actively do it, like when you are passively, when you are cooking, when you're doing anything like which is when you're doing anything, you can just passively in the background play kind of music. And also I would say there is no specific kind of music to advocate, because each person will have their own tastes and their own likes and dislikes. So according to that, you can play whatever which brings joy to you. So there are no specifications, even when in the US or anywhere where there is AMT and all those things. Even they will say that there is patient preferred music or person preferred music. So whatever music that helps you and gives you joy, and play that music. And this should not, and I kind of read it in one of these questions here, that what if that person does not like feel like listening to music? No, then that's okay, then don't listen to music. But what I'm trying to say is, when you really like music and it is not giving you any stress, what is the end result is, music must be anxiolytic, which means it should cut down the anxiety and stress. So that's all. So there are no specific recommendations. So if it is really helping you, then that's amazing, then use it. Because there are a clinical situation where music can give rise to stress, and not stress as in like you might not identify, you might not enjoy music. So that's a clinical scenario. So that is why I said that only if you enjoy music, then play music passively. So yeah, that's all I want to say. And specific I think emphasis to India do not have a music therapist or a music therapy infrastructure.
So, like we were discussing earlier, there is no fun in talking about music. There is more joy in experiencing music. And I noticed that you're ready. So I think it'll be absolutely delightful to listen to you. And
Yes.
I have to admit that I am tone deaf to music, and I don't understand music, and much to my daughter's disappointment as well. But I am so looking forward to just experience what you have to offer.
Okay. So I'm going to perform two specific Indian classical rags or scales or tunes. First one is in Shuddh Sarang. Um, so before I play it on the Saraswati Veena, let me give a prelude through vocal and know how it sounds. Mm. Sa sa ni sa ni sa re ma pa ni sa sa ni da pa ma pa ma re ni sa. So I'll sing two line Jayateva Ashtapati. Ni sa ni patita tanu rataya madhusudana mudita manojama sakhi hai Keshi Madana Mudharam. Okay, so let me play it on the veena. Next, I'm going to play this. Thank you, Pranabda. Next, I'm going to play this. So this particular piece, Shud Sarang, is mostly it gives a joyous and a little like romantic tinge, romantic wave in a sense, and What I'm going to play next is a little different. It's diametrically opposite, which is Gamanashrama. In Carnatic, South Indian classical Carnatic music, we call it as Gamanashrama, and in North Indian Hindustani, it's called as Rag Marva, which is kind of a little meditative, and sometimes it evokes a sense of weight, virah, weight. Uh, yes, so let's see that. Okay, if I sing, it would be like this. Mm, sa re ga ma pa dha ni sa ni da pa ma ga re Gare ma gare ni re ni sa. Let's see. That is gonna stop. Thank you. Bhavna, I can't hear
Fantastic.
you. I think you're on mute.
Fantastic. Am I on mute? No. Can you hear me?
Bhavna, I guess you're on mute.
Hello, can you hear me?
Yes, Bhavna, we can hear you. I
All
can hear
I
you.
still can't
right.
hear you. Oh, sorry. That's me.
Yeah.
That's okay.
Sorry. That's me. I'm really sorry. It's just that when I play music, I use the other headphone, and yeah.
I understand. That's fine.
Yeah.
I am
Thank you so much.
spellbound. I don't have words. I think I went into another world, and
Wow.
I know that I could connect with a lot of emotions, some stuff did stir up as well, but it was still um, extremely soothing and extremely calming. So, we ran the poll questions also, and it seems everybody finds that, the music can be so comforting. And
Yes,
those are the
that's amazing.
comments in the chat box as well. There was,
Okay,
a
good to read.
question about from
Uh-huh.
Anika. I'm going to ask her to speak her question. Anika, would you like to
Okay,
uh,
that would be amazing.
ask your question?
Uh, yeah, hi. Just give me a minute. Yeah, hi. Thank you, Dr.
Hello.
Tara, for very lovely performances. And
Thank
so
you.
my question was basically regarding a conversation I had with a music composer friend a couple of years ago.
Mm-hmm.
And at that point, I was very in favor of learning more about music therapy, the theories behind it, how it works, and things like that. But this person actually said that he was not in favor of music as being used as a therapy, particularly by people who are not so very qualified. Uh,
Mm-hmm.
Specifically because apparently when music pieces are composed, there's an element of building up the tension, which he felt
Mm-hmm.
would be detrimental to a patient. So apparently the pieces would be composed where you gradually build up an element of tension and or stress, and then there is this gradual decrease where you feel a release. But the whole point was that build up of the tension or the stress could be have a negative impact on the patient, and
Mm-hmm.
that was the rationale for not being too in favor of music therapy. I just want to understand what would be your take on this. This gradual build up and this release effect.
Okay, thank you so much for that wonderful question, Anika. Um, so it depends on what music you're giving to a patient. And let me share my screen and show you something. Okay. So this definition, there are definitions for hypertension, obesity, or diabetes mellitus, right? Or even cancer. So who is setting these definitions, right? You read it in a textbook or a very authentic website, right? Who is putting down these guidelines for a definition? What is the proper definition for it? So you say beyond 140 is hypertension or whatever, like when you give it, who gives it? So it is determined by a group of physicians in terms of medical thing, or any other definition is set up by a group of experts, right? So there is a definition for music therapy, right? It is very casually and informally used in India, which is not correct. What is the correct definition of music therapy? And this definition is set out in the US by the American Music Therapy Association, or AMTA, as I previously mentioned, by the set of music therapists. So let's hear it out. What is clinical and evidence based use of music intervention to accomplish individualized goals within a therapeutic relationship by a credentialed professional who has an approved music therapy program? So there are three parts of this definition. First is clinical and evidence-based use of music intervention. Now, what is that? Two kinds of music therapy. One is therapeutic and one is clinical. So therapeutic music therapy is just when you are listening to a music like in a chemo room or an operating room or in a reception, or like passive listening. Now when it comes to clinical music therapy, that is when an evidence based use. What is the evidence? So how does medical science give evidence, right? So evidences are when a group of physicians are conducting a randomized controlled trial. Why randomized controlled trial? Because that's the cornerstone of the study designs, which has a which reduces the bias and everything. That needs a bit wider discussion. But anyway, um, there will be a set of control group and case group, and control group and case group both have patients of cancer or stroke or any of the diseases. But only one difference between case group and control group will be, case group will be listening to music, a musical intervention, and the control group will not. And you give a specific music that could be Mozart sonata, or a classical piece, or any other piece, any music. And when you give that specific music and you analyze between like 0th week, which is the baseline, and 3rd week and 5th week, and figure out what are you analyzing. You are analyzing the specific thing that depends on the study. So maybe I want to study the sleep quality, maybe just generalized quality of life, well-being, generalized well-being, or depression, or any of that, pain. If somebody is in pain with cancer or anything, yeah, you can analyze that. So after that, you get an evidence. Okay, this particular music given for 3 weeks or 6 weeks is beneficial or not beneficial. Okay, when you get that evidence, you have to get it from a set of patients which is statistically significant. So when I say that, you cannot do a study in 3 patients and say, okay, in that 3 patients we found music to be effective, and let's give it to all patients. No, that's not right. So for statistically significant, you need to have a specific number. That's a mathematical calculation. So for, say, a significant number of patients, like 15 or 20 or 30. Okay, that's it. So that evidence, not only from one study, but repeated studies, right? And when you do all these repeated studies, you will get, okay, this particular musical intervention is helpful in a particular individualized goal. So it shouldn't be like, okay, patients of cancer and diabetes and hypertension. No, it should be a specific set of disease, right? Be it epilepsy. So just epilepsy patients, like that. So there should be an individualized goal. And who should give this musical intervention, even in the research, right? Even in the research setup, who should give the music? It should be given by a credentialed professional. And what music give you can give that, that is like either that is experimental. Okay, now that said, once you have the evidence over the years, over the populations, like over like 10 studies and 12 studies, we have confirmed, then that music can be given to a patient. So when you said about the music composer said what he said, that is maybe a particular set of music. So we do not, so as a clinical music, as part of clinical music therapy, you do not give any music to a patient. So that's what I'm trying to say. It is very casually and informally used in India. Like if you listen to music, a patient listens to music, that's music therapy. That's untrue. And the point, and there's something, a matter to lament here, is we do not have any of these. We do not have a music therapist to conduct this research. We do not have, we do not have much music therapy research going on with Indian classical music, or for that matter, any of the Indian music, maybe Bollywood music or any of that music. So we cannot say that way. And so now I think do you have any other doubts with this? Is the explanation good enough, or?
No, I think that. Thank you for that explanation. I get the difference in what you're saying. The emphasis is more on the fact that the pieces that are used uh, in music therapy as it ought to be and as it is certified are actually pieces which are have been experimented rigorously upon over a long time and therefore are well established.
Yes.
So
So
I get
music
that.
is different. Music therapy is different. So you
Yeah.
don't give any kind of music unless it's therapeutic music, like in a hospital hallway, you're playing a music. Then you can play some instrumental passive music. But in terms of clinical active listening to music, that's a very serious thing. You need to have medical research evidences to conduct something of
Got
that
it.
sort.
Thanks. Thank you.
Thank you.
Thank you for asking that absolutely pertinent question, Aneka, because in everyday layperson parlance, there is a lot of the word therapy that is used and very often misused. So, for example, one would find somebody say, um, retail therapy works for me, or why do I need therapy? I have a pub, or I have friends. So there is a colloquial use of the word therapy, and there is a technical detail and a rigor of therapy. So thank you for bringing that up. And thank you, Dr. Tara, for patiently taking us through that. I'm going,
Thank you.
I'm going to ask Harshita to ask her question. Harshita?
So, ma'am, this is Harshita.
Hello, Harshita.
I just have this question. Is the therapeutic effect only from certain soothing sounds of certain instruments like Veena, or can playing any instrument itself through its effects, in like, could it have some effect on the wiring of neurons and be a therapy?
So I guess there are two parts to it. So is it just Veena, or is it just any specific instrument? And second part is, does it have any influence on the neuronal pathway? So first,
Yeah.
for the first question, whether we have, these are all anecdotal evidences that, and also a person's preference, that okay, when I listen to music, I mean Veena, or I feel good, or something like that. But as I said before, we do not have any statistically significant randomized control trials done in various Indian instruments. So as a physician, I cannot say or advocate, or advocate, yes, but not advise uh, that okay, this particular instrument has a good effect versus guitar versus a piano or something of that sort. No, because only, as I said, randomized control trial evidences on multiple patients done in all across the span of India can only uh, give a give a conclusion on that. And secondly, it could also be like, it's also a matter of preference, right? Perhaps even when you do randomized control trial on Indian patients on an Indian instrument, perhaps for some it will work. That's again patient preferred music, and sometimes it will not work with the same instrument which has um, a scientific basis, which is done in India, might not work in anywhere else. So there is cultural impacts as well. And second part of the neurological, so when you say a music, a specific music is calming you or soothing you, it is it is the neuroendocrinology of the human body, right? So to explain that, I will again share my screen. uh, okay, how can I share my screen? Okay, yeah, let me show you how it is. Okay, right? So basically, it's kind of a little complex, but anyway, what I'm trying to say is, you can see in the red color, whatever I have done is all complex research findings, which is milestone research findings as well, done all across 1998 to 2010. So it's like it is dispersed across the span of these decades, and it's not like one day's effort. So uh, okay, so at the neurophysiological level, like autonomic nervous responses, there is an impact on autonomic nervous system, which is like, okay, there is reduced, the pulse rate is reducing, and as a bit of anxiolytic effect of music is there in suppressing the sympathetic nervous system, and then that leads to decreased adrenergic activity and decreased neuromuscular arousal. Okay, then there is this hormone, you'll be knowing, this cortisol, which is a stress hormone, which is which is a stress hormone, and so that will be reduced when you listen to music or when you play a music. And also there are happy neuropeptides that get that get released. And also another slide which I want to discuss is here, endorphins. So endorphins are happy hormones, right? When you exercise, when you dance, these endorphins are neurotransmitters, happy neurotransmitters that get released, right? So when you listen to music, the same thing happens. So basically it triggers the limbic system to release the endorphins. And the next one is a bit complex. It's about there are specific centers in the brain that gets activated, which is also the centers which are pleasure centers, which are called as pleasures, right? When you are happy, uh, so these are pleasure centers. So these are these centers. I think that's very complex, and going to stuff like, if you want it personally, I can definitely send you all these papers. But then, yeah, in a nutshell, yes. So that is the research going on, and there is no. It is still going on. It's an expanding area of research, and it's going on. And now the researchers are mostly like among musicians and non-musicians, like trained musicians and non-musicians. Is there any difference in the neurological pathway? So it's kind of like an expanding area of research. So yes.
So thank you for that, Harshita. There was a very deep technical response. Um, so there was a very deep technical response to that, as was expected from Dr. Tara. But simple answer being, yes, there is an impact, and uh, and we have research to back, and that's wonderful, and that there is ongoing research. So a question that came up for me, and as somebody who may have been many years ago a caregiver to somebody with an your autoimmune system, I would have liked to know that music may have helped. Now, what can be some resources where a caregiver can go to figure out what is right music? Should you consult
So that,
a trained therapist?
no, there are no trained therapists in India, right?
Oh,
I mean, accredited. But I would say, even then, even if you had a music therapist at your hospital, I think the first thing they would ask is, what is your preferred music, right? So if I am ill and I specifically like a particular genre of music, and music therapist plays something a diametrically opposite genre, which I am not uh, which I don't dislike, or which I'm not like trained to enjoy or something, then I wouldn't like. So the purpose is to reduce anxiety, and you cannot like play a music which is not giving you joy, right? So anywhere, even in India or anywhere where music therapy is accredited or not, the first question by a music therapist will be patient preferred music. So I think the kind of music, like, if you have already identified a music which which is maybe a folk song or whatever, that helps you calm down and make you joyous, I think play that. And there are no to my best of knowledge, I don't think there are any data sources for music as such. As I said, whomever has that music therapists and their association, uh, I mean, they don't have a source of music, so it's personalized. As I said in the definition itself, for an individualized goal, there is like a particular music or a patient preferred music, that way. So it's completely personal. So in India, I would say, just listen to whatever music that gives you joy from YouTube or all these sources. um, I think that's the only thing. And recently, I've collected this set of. I mean, I have recorded a set of music, which I'm freely giving to NGOs and palliative centers. So, which is there on my website as well. If you like, again, like, if you if you listen to it and that helps you, and if it's kind of anxiolytic, then yes, feel free to download it. It's there on my website. It's www.tararajendran.com, where there is downloads, where you can freely download this music. And yeah, but apart from that, I would say whichever sources, Wink Music or like YouTube or any kind of like normal sources where you listen music from.
So I am very encouraged by that because I have no understanding of classical music and I'm quite ashamed of that, but I'm going to let that pass. And I'm going to think that if it's everyday music that energizes me, that is the one that is for me. So
Yes.
there is another question by Pranabda. So I'm going to ask him to ask his question.
Okay.
Good evening,
Good evening.
Good
Bhavana
evening,
and
Uncle.
Dr. Tara. Yeah. Uh, one thing, how do the music play a vital role in chemical biology of a patient suffering from pain um, with any non-communicable disease like cancer? Is there any uh, root, is there any passing through the chemical biology, how it plays to soothe the pacify the pain?
Thank you,
And
Uncle, for that
yeah,
question. Yeah. Continue. Sorry.
you just reply.
Okay. So basically, what music does is a distraction. It's a form of distraction. It does not do the same effect of morphine or any of those medications, but
Yeah.
it is just like if the pain is like 10 on 10, like nobody is saying that okay, when you listen to music it will reduce, but all I'm saying is that music is a distraction, uh, and that is one thing. And also the physiology of that, or the neurology of that, is still being studied. So it's just that the pain, anxiety, and or the depression, their pathology is related with one neurological pathway, and which is kind of similar to the pathway of neurological pathway of music. But then the studies of the latest studies have said that, but then that is said, we need more confirmatory studies and more studies to expand what we know by now. I think the researches are still going on, and definitely music will not do job of morphine or a painkiller for sure, but it's all it does is kind of a distraction.
Actually, uh, I have experience with my wife. She loved her favorable songs.
Music.
So during her pain, horrendous pain, she used to listen to her favorite song
Yeah.
and pacifying the pain. And ultimately, at the end, Bhavna, I am surprised. At the end, she told me to bring her diary, and she wrote that music is the path to reach God. And that the tuning, the music leads her to God, and she wrote in the diary personally and told me to read out. And really, I thought that does it lead to the spirituality? The music leads to the spirituality and pacifying the pain. This has an important role, I think so.
That's
So I think, Uncle, that kind of needs a wider discussion, and also, I mean, in-depth discussion. And also, I would say that the effect of music, the impact of music has also to do with the memory associated with it. So for example, when you listen to a music which you had listened in the past, when at a happy time, be it in a spiritual way or a happy way, like a childhood memory or something that can make you nostalgic and make you feel good, that also has an impact. So it's not just one rational, I mean, one reason. There are many reasons for I guess the impact of music.
So
Yeah.
it's worthwhile to do some scientific experiments and some research and figure this out. But my intuitive response is that if you look at, for example, the Sufi culture, rests very significantly on music leading to spirituality. And there is the whole bhakti movement in which it is believed that you have some connection and worth our while. I totally agree with the point of memory triggering, memory being triggered by music. It happens to me definitely. And I know this has been a very energizing session and it has triggered a lot of calm and a lot of questions at the same time. Aneka, we will definitely take your question. Would you like to ask it yourself?
Yeah, thank you. So I'd also like to understand if you have any either anecdotes or experiments that you can share regarding use of music therapy with children, either very young children or adolescents, anything that you may have come across during your, you know, study on study of literature.
I can find you one right now. So
Oh,
which
great.
is so this study is Mozart K448, which is a Western classical musical piece. It's a gorgeous piece. So they tried this specific K448 on various populations of pediatric epilepsy patients. And pediatric epilepsy has a different varieties. So they have tried it on, different classifications. So they tried it on all various populations uh, across the continents and over the decades. And there are a couple of studies. So if you just type like Mozart K448 in children with epilepsy, you'll get it. And I think that's with uh, children, I guess. Yes. So but then that is just one example, but there are several plenty of studies done in autism and many other I think realms. I think something to explore, and definitely I think I do have a couple of literature, so I'll be more than happy to email it to you. Yeah.
Oh, great. That would be lovely. I'm associated with a NGO that's based in Chennai, working with children, and we have a pretty large number of kids with cancer getting referred to us. At the moment, we do art-based therapy with them. I was actually trying to see if music in some way can be also, integrated into the services we offer. So I'd like to study this further.
Definitely.
Thank you.
Definitely. And also I think the one I think while reading all these interventions, I mean, anyway, we don't have like a music therapy, but then what we can do is to these children, we can give like a piano or like a guitar or something like a ukulele. I think I'm not familiar with that instrument, but something of that sort, like a small guitar. It's so I think actively doing something, I think children might love that, actively doing and involving in okay, so there are various musical interventions, right? According to AMTA, so there are various ones. One is just listening to music, and second one is like when like clapping hands and tapping your feet and like swaying when you listen to music, and maybe like writing a music, right? All those things, and one of which was also like interpreting the meaning of music, and that's actively involving in it. And one of which was playing an instrument. So I think, yeah, again, that is also something to read up, the various interventions of musical interventions. So I can send it to you in
Yeah, I'd
info.
love to interact with you further on this.
Yeah,
Thank
yeah,
you.
sure, sure.
Thanks, Bhavna.
Most welcome. Thank you for asking such lovely questions. So it's good to have healthy interaction.
Yeah.
It's
I
a field
also
of interest.
yes, I noticed that you are quite a regular in our webinars. So it's lovely.
Thank you.
You know what came up for me is that because our focus is on caregivers, and it is, the idea of music is not just for the patient. I would think that for caregivers, um, remembering that music being an opportunity for you to create self-care, and remembering that music can be an easy way of having your time. And perhaps music can also be that thing with which you bond between the caregiver and the care receiver, can be really the way to look at whether or not, you're a person like me who doesn't really understand music, or you're a person like Dr. Tara, who is this exponent in music, but and anywhere in between. But it can certainly be an opportunity to. We found that 100% of our audience said that they were soothed by the lovely music you played. So thank you for that.
Thank you.
And
Thank
if
you.
that's any evidence to start with, but I do think that perhaps caregivers can take away for themselves that they can start by creating uh, me time, their well-being, by listening to music as much as they do it for the people that they care for. With that, I know we are busting time boundaries. I'd like to ask for your closing remarks, Dr. Tara.
Thank you. Oh my God. I mean, thank you so much, Bhavna, for this amazing opportunity, because I was just, reading the chat session, and oh my God, this is so overwhelming that thank you so much for the compliments, all of you. And also, somebody has said, okay, this is an eye-opening session. No, it's just that it's an honor to advocate and talk about music and musical interventions in healthcare, and if it helping them for caregivers and also to patients. So I think it's an honor and it's a blessing. Thank you so much, Bhavna, for inviting me. It's something that I'm going to cherish forever.
Yes, I would like you to remember that in the chat, people have said things like, it was really soothing, it was very
Yeah,
comforting. Thank you for the brilliant music. It
so
was one
sweet.
of the best sessions so far.
Oh
It
God.
was an eye opener. So, thank you for bringing so much joy. And I hope that your dream of setting up music therapy is manifested, and we will do what we can at Caregiver Saathi
Yeah.
to make it happen, because I personally see that music therapy may have a big role to play for caregivers.
Yes. Thank you so much, Bhavna.
Thank you. With that, I'd like to thank everyone who was with us this evening. Thank you for joining, and have a great weekend with lots of music and lots of love. Enjoy your evening and the weekend. Please leave by giving us feedback on how your experience of the webinar was.
Thank you, guys. And also, one more thing, in case you have any additional questions regarding music and medicine, please feel free to DM me. My Instagram handle is Tara_Rajendran. Tara_Rajendran. So, yeah. It's always nice to have a conversation on music and medicine. Yeah.
Absolutely. We will share some more details, and we will figure out how we can leverage the music you're sharing. Thank you. So, thank you very much. And with that, we will bring our session to a close. Thank you for sharing your feedback. Fantastic feedback. Thank you, Tara. Have a great evening.
Thank you.